evening from wherever you're joining around the world. This is the Nigerian Society of Anesthetists Education webinar. You would recall that we had one in January, and we are having the second one now for this year. So it's a bi-monthly meeting. So every 2 months, we are going to have an interesting subject for discussion. And today is another day, and we thank all of you for taking out time out of your very busy schedules to join us. Thank you very much. And we know that you're going to have a wonderful time. As a basic ground rule, please mute yourselves. I have seen that most of us are already muted. Please, if you're not muted, kindly mute yourself. And in the course of the discussion, if you have a question, kindly put it in the chat, and it will be addressed properly at the time of a Q&A. We have a pre-recording of the webinar for today from our erudite scholar, and we are going to be playing the pre-recording, but the speaker is on the call. And at the end of that pre-recording, she is going to be answering our questions. We often say that anesthesia is similar to flying an airplane. And today we have an aviation expert who is going to be introduced by no less a person than our own Professor Saidu Yakubu. Professor Yakubu, kindly introduce our speaker.
Thank you very much, Ma, for the great opportunity. It is my pleasure and honor to moderate today's NSS webinar session on safety checklists, learning from the aviation cockpit drill for safe anesthesia. Our speaker today is Dr. Esther Eresi Ayeshe Shitu Ni Inwerogu. She was born on the 30th of March, 1960 at Jos Plateau State of Nigeria. She attended St. Teresa's Girls Primary School, Jos, and also attended St. Louis College, Jos, between the period 1972 to 1976. She is a pioneer graduate of the University of Jos Medical School. She attended the medical school between 1976 and 1982. She did her housemanship at the Ahmad Bello University Teaching Hospital, Zaria, and then her National Youth Service at St. Luke's Hospital, Wusasa, Zaria. She entered into private practice and practiced at Terra Medical Center, Zaria for 15 years. She was a chief medical officer at the Aero Medical Center, Nigerian College of Aviation Technology, Zaria, for over 21 years. She retired from the Nigerian College of Aviation Technology on 30th March 2020. But because she's so good, she was contracted again to work for the period 2021 to 2023. Now she's on a contract appointment at the Nigerian Civil Aviation Authority, serving as the head of the aeromedical standards at the Murtala Mohammed Airport, Ikeja, Lagos. As I mentioned earlier, she attended University of Jos, where she obtained her basic medical degree. She also had a master's in public health at the Ahmad Bello University there in the year 2008. And then she attended basic aviation medicine training, Federation Aviation Administration, Civil Aerospace Institute, Oklahoma City, Oklahoma, USA, during the period 2002. She also had advanced training in aviation medicine at King's College, London, United Kingdom, during the year 2004. She had a postgraduate training for aviation medical examiners and assessors in the year 2018. And then she attended numerous workshops on management, leadership, and other relevant disciplines. She will talk to us for about 25 to 30 minutes. And to reiterate again, if you have any question or comment, please put it in the chat box. After the slide has finished playing, she will answer the questions and the comments. And then again, it is very important that we're all muted. Thank you very much. I wish us a very nice session. Thank you.
Good day, ladies and gentlemen. It is a pleasure to be amongst you today and sharing this interesting topic. And the topic is safety checklist, learning from aviation cockpit drill for safe anesthesia. It is presented by Dr. Esther Eresi Eshitu, the head of Aeromedical Standards Department of the Nigeria Civil Aviation Authority. Description of terms and items. I'll start by describing some terms that are a bit familiar and non-familiar before we proceed into the main area and the integrity of the topic. Aircraft cockpit is the area in front of the aircraft from where a pilot controls the aircraft. And drills are correct and recognized procedures or ways of doing things in both normal or abnormal situations. Checklists are important assets that assist the crew in performing their duties in an orderly and listed, documented, and acceptable manner. This is a pictorial view of a cockpit. It is actually the 777 cockpit, which is called the glass cockpit. It is an advanced form of an aircraft cockpit, having been digitalized from the analog type. So we still have all the important elements of the cockpit that the pilots are put through. Anesthesia, on the other hand, is a state of controlled and temporary loss of sensation or pain during procedures or surgery by use of medications. There are various types of anesthesia and techniques of anesthesia with different levels of expertise and experience. Anesthetic machine. This is a medical device used to deliver a precise mixture of anesthetic gases and other medications to a patient before, during, and after surgical procedures. The medication induces and maintains a state of unconsciousness or sedation. It also reduces pains and sensations during certain procedure. This is a picture of an anesthetic machine. I'm sure there are various types in the market, sophisticated ones and simple ones. But this just illustrates a basic anesthetic machine. Use of anesthetic machine checklist. This exists and could be briefly highlighted as when the machine is off, you check that it is plugged in and switched on. You check high and intermediate pressure system. You test the ventilator circuit for leak, and you check the low pressure leak test. But when the machine is on, you check that the emergency flow meters and oxygen flush are okay. You check the vaporizers, you check the breathing system, as well as the ventilation system. You test bag circuit for leak, and you check the ancillary oxygen supply and anesthetic gas scavenging system, as well as check the monitoring devices connecting and working appropriately. Final position check. You check that the ventilator setting is okay. You push and twist all connections of breathing. You check all ancillary equipment like intubation aids, laryngoscopies, forceps, and all the instruments you might be needing. Then you document all observations appropriately. In aviation, safety checklist does not only start in the cockpit. It starts with the 5 Ps. That's planning, the plane itself, the pilots, the passengers, and the programming. So these are known as the 5 Ps in aviation. Let's start with the planning. Planning will be like flight plan for weather conditions, the route to be taken, the potential hazard that might be encountered on that route. And then the plane, there's a thorough check of the aircraft system using checklists, and then of the performance capabilities as well. The pilots' physical and mental states, fatigue, stress, and readiness to fly, as well as overall capabilities. We also have to check the passenger needs, the capabilities, the experience, and special needs. Some passengers might be flying for the first time, so there's also the flight phobia, and they will need to be reassured. Some might have flying sickness, and they need to be put through on how to manage that. And some may be needing special assistance, like those in wheelchairs or using crutches or cane. So these need to be also checked. There's a checklist for passenger with reduced mobility or passengers with special needs. Then, of course, the programming comes in. A checklist exists for the navigation system and any other software system used during the flight. This has to be gone through using the prescribed checklist. This is an example of a flight plan, even though this is done in Barcelona, Spain. It shows the route the aircraft is going to be on and the various terrain that it will be going through. It is just an example of a flight plan. And this is an aeroplane part showing you the cockpit, which we have shown, the fuselage, which is where people stay, passengers stay, and payload is carried on, and all the other parts of the aircraft that I'm not going to go into right now. This shows the pilots in the cockpit going through the checklist and going through the 5 Ps like we have illustrated below. This would have been prepared prior to the flying time and only gone through at a last check before takeoff. This is called the I'm Safe checklist, and it applies to the pilots. I stands for illness, M for medication, S for stress, A for alcohol, and F for fatigue, E for emotions. I will elaborate briefly on the I'm Safe checklist. The I'm Safe card is a personal checklist that ensures the following statement is valid. I'm physically and mentally safe to fly, not being impaired by illness. The safest rule is not to fly while suffering from any illness. The pilot should contact an aviation medical examiner for advice if he is ill. Medication. A pilot performance can seriously be degraded by both prescribed and over-the-counter medications, as well as by the medical condition for which the medications are taken. Stress from everyday living can impair pilot performance, often in very subtle ways. Alcohol consumption and flying can impair flying skills. In aviation, there's what we call the bottle to throttle rule. You can have some level of alcohol or some limit of alcohol 8 hours before flying. However, the alcohol should not exceed certain units per day. For instance, a male is allowed 5 units daily, while a woman is allowed 3.5 or 3 units per day. That is another topic for another day. Fatigue and lack of adequate sleep continue to be some of the most treacherous hazards to flight safety. And that is when aviation, 8 hours of sleep is usually advised. Emotions of anger, depression, and anxiety may lead to taking risks that border on self-destruction. So this briefly illustrates the I'm Safe checklist, which applies to the pilots. When we talk of integration, in aviation, the shell model, software, hardware, environment, and liveware, is a conceptual human factor model. And the model helps analyze and understand the interactions between humans and technology, focusing on how different system components influence human performance and safety, thus emphasizing the importance of the human component in any system. This is the shell model, which I have just explained. The S is the software, the H is the hardware, the E is the environment, and the L is the liveware. So the liveware in the center is the core person, maybe the pilot in aviation, and then the other L are other people that the pilot interacts with, the cabin crew, the ground staff, the air traffic controllers. By use of a checklist, the core person is able to check if the software is working properly, if the hardware is working properly, if the operational environment is conducive, and if the interaction between him and other colleagues or liveware is optimal. A checklist. This is an essential tool that pilots use to ensure safety and efficiency. It verifies critical tasks before, during, and after flights. It is used at all phases of flights: takeoff, climb, cruise, descent, and landing, including engine shutdown and parking. Checklists provide systemic approach to performing routine tasks, thereby reducing errors. It serves as a memory aid, ensuring critical steps are not omitted during emergency situations. It also provides clear, concise instructions, allowing for compliance with manufacturer and regulatory requirements. This is an example of a checklist. It gives you what to do at each critical time. After start, you need to check the anti-ice, you need to check the ECAM status, you need to take the pitch trim, rudder trim. And before takeoff, flight controls, you check both. Flight instrument, check both. Briefing, you confirm. Flap setting, confirm both. And then all the other ATC setting and every other thing that needs to be checked. You can see some areas: cabin crew advised, engine model set as recorded, and parked. So after takeoff, you do the ledger gear up, flaps retracted, parks, and then you look. Barometer reference is set on both sides. Seat belts are on, barometer set on both sides, engine model as recorded, and cabin crew is advised at landing. After landing, flaps are retracted, spoilers are disarmed, APU is started, and the radar is off and at standby. And then when you park, the APU is off, the engines are off, the seat belts are off, and then you parking brake and chocks as required. So you also consider heavy rains. And then when you are securing the aircraft, you look at the oxygen is off, the APU, the emergency exit is off, APU and BAT are all off. Then you also consider the weather conditions. Drills in aviation. Drills involve rigorous trainings in classrooms, training by instructor pilots on live aircraft and simulators, and also learning how to use and apply the various checklists. So you don't only have a checklist, you carry out drills to make sure that these checklists are actually relevant and are practiced and used as they should be. And emergency drills like fire, ditching, engine failure are practiced usually in the simulators, not on live aircraft. And emergency preparedness is rehearsed 6 monthly in simulators to prepare for emergencies. This is a simulator. This is a brand type called Alcin. Just like you have various brands of cars and aircraft, you also have various brands of simulators. And pilots are usually trained on the type of aircraft they are rated on. So they are able to practice and repractice and rehearse procedures using prescribed checklists. The procedures are usually both normal or abnormal ones that could occur during emergencies. So there's a preparedness to always fly in normal conditions, and when the need arises, to also handle the emergency situations. Replicating aviation cockpit drills for safe anesthesia. Aviation cockpit drills are being replicated in various industries and sectors. This has led to better performance and outcomes, and it has narrowed the error margins. It also pinpoints where attention should be focused. Is it on the software, which are the procedures, the hardware, which is the equipment, whether the anesthetic machine or the aircraft itself, the plane, as the case may be? Is it the environment, that's the operational environment, like the theater or where the machine is housed? or is it the aerial environment or spatial environment in the case of aircraft? Or do we pay attention to the human component, which is the life? So applying these drills would involve looking at the procedures, the techniques, and the software that we use, and also formulating checklists for the procedures, taking the functions and functionality of the machines, which is the hardware, into consideration, as well as considering the operational environment. We will also look at the skill and readiness, physically, mentally, of the anesthetist in this case. Error detection and inspection with the use of checklists and drills. Errors will no longer be tied to humans alone if we use checklists and we practice the drills. Procedure, machine operating environment, humans, or coordination or interaction between humans could all be the sources of error, and it will be easy to pinpoint where the error lies if we use checklists that we have practiced drills on how to use. An enhancement of regular training in real-time anesthesia and formulating simulations involving checklists and regular periodic drills would aid error detection. In conclusion, objective use of checklists and drills greatly improve safety, not only in the aviation sector, but also in other sectors, including the health sector, of which anesthesia is a core and vital part. Thank you all for listening. It's been a pleasure delivering this topic. Any questions? Thank you.
Thank you very much, Dr. Esther, for the great talk. I will summarize what you have said. You started by describing some of the terms that are used in aviation and anesthesia. You showed us the aircraft cockpit, and then you said that checklists assist the pilots in performing their work. And you define anesthesia as a state of controlled temporary loss of pain. You went ahead to talk about the anesthesia machine check, and then you talked about the 5 P's of safety check, which include planning, the plane, the pilot, the passenger, and then the programming. And then also another checklist used by the pilots, I am safe. For I, with I standing as illness, M, the mental state of the pilot, S, stress level, F, fatigue, E, the emotion. And then we also will talk about the shell model with S standing for software, H standing for hardware, E standing for environment, and L, liveware. All of these interact to either cause errors or ensure that there is no problem. You went ahead to talk about checklists. You mentioned that the checklist is an essential tool used by pilots to ensure safety and efficiency. It helps reduces error. And then you went to talk about drills in aviation, which involves rigorous classroom sessions, and then checked by live pilots, instructors, and simulators. And then you went to talk about replicating aviation cockpit drills for safe anesthesia. You talk about the improvement in performance. It helps with errors. And then you mentioned lastly that there are multiple sources of error, could be from the procedure, the machine, the environment, the personnel involved, and so on. And then you concluded by saying that safety check is very, very important in reducing an error and then to ensure safe anesthesia. Thank you very much, Ma, for the great talk. We highly appreciate. So the floor is open now for question and answers and comments. Thank you. So there is a comment on the chat. Excellent presentation. Someone posted, thank you, doctor. And then another person posted, thanks, Ma, for the lecture. Interesting and very useful results from the aviation industry that can be applied in anesthesia. Another one, excellent presentation. Well done, Ma. Thank you. So far, those are what we have on the chat, except we have, if there is any participant that want to raise their hands, yes, so that they can comment. I have not seen any hand raised except yours, Ma. You want to go ahead and comment, Ma? Thank you.
Good day, everyone. I'm sorry there was a mix-up in network issues and I wasn't able to take it live. But thank you for your foresight that you asked me to give a recorded presentation of my slides. Otherwise, I think would have had a lot of issues this afternoon. So I was able to hear everything, but couldn't talk. Oh, I couldn't hear you, but you could hear me. But towards the middle of the presentation, I heard everything. And I'm happy at the reception given to the presentation as well. Thank you all for listening. Now you are hearing it live and clear. Thank you all.
Thank you very much, Ma. So another comment for you. Thank you, doctor, for the wonderful presentation. And then another person posted, thanks so much for the excellent presentation. Question to all the anesthesia elders. Question to all the elders. Anesthesia machine check are taught to us to memorize, but can a standard checklist be developed in which the steps will be marked one by one and attached to the World Health Organization safety checklist? So this is a question to the elders that are here. Mr. President and the chairman of also the chairman, president-elect actually, who doubles as the chairman of the education committee of the NSA. Ma, the question is to you. Thank you.
Which let us first.
Another comment, brilliant presentation, Ma. It makes us more cautious. Thank you.
Thank you very much for that beautiful presentation. A lot of take-home messages. And I know that we have the recording and it's going to be on our YouTube channel so that for future references, we can still go back to it, read it, and get the take-home messages from me. Yes. Actually looking forward to not just adopting all American Society of Anesthesiologists guidelines and all the other guidelines around the world that we have been using. We as a society have come of age, and it is time we develop homegrown guidelines, which is part of the reason we have this discussion. I don't know what the experiences are, but I think that we don't have 100% buy-in to even the WHO safety checklist that you are talking about. So that was one of the things that informed us putting this as a topic for us as safety champions to look into and see how we as anesthesiologists, knowing that anesthesia is often compared to aviation, how can we be safety champions in all respects? And the speaker took us through the anesthesia machine checklist, but then in discussing the aviation checklist, she talked about everything that is checked. The passenger is checked. And in our own case, maybe our patients will be like our passengers. The pilot is checked. And other, members of the crew, everything is checked. The weather is checked and all of that. So It's much like what we do. We do preoperative assessment. We monitor everybody, including the surgeon. We monitor everybody. And of course, we look after our patients. So it's something that we are going to have to look at holistically. And we are going to be calling on some of us in the room who, we believe can sit together and come up with some guidelines that can be homegrown. That will be all for now. I think our president is on the call. I don't know if he will have a word or two to say in that regard. Professor Dati, please.
Yeah, thank you very much. Thank you, Dr. Shitu. I want to say I'm very glad that I was pleased when I heard that your citation that you are the pioneer set from Jos. So we are great Josites. We always shout grace on Josites. So thank you very much. I agree with the president-elect that we will have to develop one checklist as a guide, just to help practitioners across Nigeria to have one checklist that you can always apply without compromising. You can apply it anywhere, depending on what you have. I think it's been there before, but we've been throwing caution to the wind, and we know all the mishaps. But now people are aware a lot of mishaps do happen. And if you trace it, you will find out what she presented on fatigue, stress. They are prominent these days. Now we have a lot of our colleagues that have left the country. So the stress and the burden of anesthetic practice is on us now. So fatigue is real. So I think what we need to do is to try and develop this checklist and be applying it. The comment by someone commented on the chat box that trying to link it with the WHO checklist. The WHO checklist, it considers all the stakeholders in the operating room. It's just telling you that this is the last checkpoint. Check to see, do you have any issue when you're doing your own checklist and you say, oh, you have oxygen, but it is leaking seriously. You can voice it out there, and then the team will consider and say, no, this is not safe to proceed. So the checklist, I think, is what we need, the checklist more than ever, because now that we have the workforce has been shrunk, to unbelievable levels, and fatigue is real. This has happened to me. I've given drugs erroneously because there was cumulative stress on me. I always remember this, but patient was safe in the end, but I knew what I've done. Nobody knew. And I tried to write something out of a book when I was tired. It was during my residency training. And then I wrote the same page again when I was okay. And if you see the errors that I committed the first time, there is real. So fatigue is real. So, but I think the WFSA and the NSA and all the affiliates of WFSA, they are doing something now that you have Committee on Workforce Wellbeing. So I try to link this Workforce Wellbeing Committee, the activities that they want to do, all to improve safety. And I checklist is mandatory. We need to develop one. I agree with the person that said that we should have one. We used to have, I think we need to look at it again and circulate one that can be used across the country. Thank you very much.
Thank you very much, sir. On the chat, Dr. Aderonke Adesina, she made a comment. I think we have many guidelines and checklists for safety with focus on our equipment. However, we don't have focus on the anesthesiologists and other personnel. particularly self-appraisal and guidelines to seek for support. And then she went ahead to say, we know a fatigue anesthesiologist is unsafe. So we need to have an I am safe checklist in anesthesia in Nigeria. Very excellent presentation. Well done, Ma, from Dr. Idris Mohammed El Amin. There is another question. Thank you for the lovely presentation, Ma. That is to Dr. Esther. Considering that the target is to improve patient safety and reduce perioperative morbidity and mortality in anesthesia, what steps are we taking to establish our environmental friendly and sustainable anesthesia practice checklist in Nigeria? I think this is for Mr. President and the NSA ESCO. Thank you very much.
Yeah, thank you very much. I think from my last comment, I have already answered this question. Dr. Adeshan also said that there are many checklists. I think what you need to do, like each department, the head of department is the, what do you call it, the head of training, the practice, everything is supposed to formulate policies and so on. So the department can sit down and see, this is the checklist that we are going to adopt. You modify it and you make it a policy in the department. This is what we are going to be using. What we want to do at the NSA is to circulate one that you can adopt. If you want to adopt the one from the AAGBI and you can apply it, that's okay. They're comprehensive. So I think the onus is on the heads of department because they are the chief policy makers for the department to ensure safety. So that is what we need to do. Already the WHO checklist is being practiced in many centers, but then for the anesthesia is comprehensive. At the beginning of the session for the day, there are things you do. And then between cases, there are things you should check. And then when you finish, these are the things you should do. So this must be embedded in the departmental activities. So the onus actually rests on the department, but NSA will be a driving force and will advocate for this checklist policy. We'll do something about it. Thank you.
Thank you very much, sir. I want to recognize the presence of our seniors, Professor Ilori, Chairman, Faculty of Anesthesia, West African College of Surgeons, Professor Sadiq, Chairman of the Faculty of Anesthesia, National Postgraduate Medical College of Nigeria, and then Professor Elizabeth Ogboli Unwaso, the past president of the Nigerian Society of Anesthetists. Please, you can feel free to go ahead and make comments. Thank you.
I think Professor Eleven may be on this call too. Maybe iPhone.
Okay, sir.
Hello.
Thank you,
thank you, Dr. Yakubu. Thank you, Professor Yakubu. Thank you, everybody. I want to thank our amiable speaker, Dr. Mrs. Shitu, for accepting our invitation and for doing us the honors and for the brilliant presentation. Ma, we are very grateful. And the safety issues continue to be a big issue in the practice of anesthesia and in medical science in general. Patient safety is a big issue. And I thank you because of how you brought out all the salient features and the similarities. My call is to all of us, all and sundry, that we should not rest on our hours, but we should continue to pursue every aspect of patient safety so that in the end, our practice will continue to get better and better, and our patients will be all the more happier. And that will, of course, increase patient satisfaction. Thank you, everybody. I thank the senior colleagues and colleagues that are here, especially I've seen Professor Ilori, the president-elect. I've seen so many people. If I missed you out, please pardon me. Thank you all so much. Dr. Naji, also, I saw him in the attendance. Thank you all very much. I appreciate it, and thank you for the opportunity to make a comment in this webinar. Thank you, everybody. Over and
Thank you
out.
very much, Ma, for the comment. Professor
Okay.
Ilorima,
Okay.
Professor
Hello.
Sadiq. Yes, Ma.
Thank you very much,
Now,
Dr. Esther, for the lecture. I hope you can hear
last
me.
year.
Yes, Ma. Thank you.
Yes, we can.
I've listened to the lecture. It's
Nansani.
quite stimulating, and there's a lot of similarity between
Aki
the
Lebudia.
aviation. But only that in Anaesthesia, we have not been able to develop a checklist in which we can mark which people have put on the chart. And the issue of developing a checklist of I'm safe for the anesthetists. I know there was a time that the previous administration sent out a circular or a form for us to whether we know of any anesthetists that are abusing drugs. And if part of this drug abuse is because of fatigue or because of a lot of stress. So I think it's really important that the NSA should not rely on individual departments making sort of a safety checklist for their department. I think NSA should gather people that could have a committee or gather some people to draw up a safety checklist in line with the aviation. What we do pre-anesthetic, what we do before induction, what we do after induction, at the end of surgery. You can't find that in most of our hospitals, when people finish anesthesia, they left the machine on with the gases blowing. And if we had this checklist and they follow, people would remember that they need to turn off the oxygen. They need to turn off the machine. And also how they would handle the equipment. In our hospitals, we have a lot of monitors that is lying about. The cables are bad because we do not have a checklist on how to handle those delicate equipment. So it is good that we, as a society, as we have said, that Nigerian Society of Anesthetists have come of age. So we need to start developing our own checklist in line with the reality on ground in our own environment. Thank you very much.
Thank you very much, Ma. Professor Elegbe, Ma, you are welcome to make comments. Thank you, Ma.
Maybe she's not on the call.
Oh, okay, sir.
I knew that she said she would join, but I saw Dr. Naji, his hand has been up for a while.
Yes, that's true. Dr. Chima Naji, please, are you still there? You can go ahead and make comments.
Okay, thank you, Professor Yakubu, and thank you, my seniors and NSA presidents. I just wanted to say little things. I think NSA has come of age at this point, and it's high time we start designing a universal safety checklist for our anesthesia practice. We can take them step by step, and before we know what's happening, we'll be able to cover everywhere. Yes, the head of departments are saddled with the responsibility of designing such policy. But if we come out with a universal safety checklist for anesthesia practice in Nigeria through the NSA, the various departments can now modify based on their peculiar issues in their environments. That's what I'm suggesting. We can start from the use of oxygen. From there, by the time we standardize that, we'll move to the next one, or create different committees to look into different checklists, anesthesia practice, the use of opioid by anesthesiologists, and as well as equipment, like the presenter mentioned and some other comments. Most of the checklist we have is just all about anesthesia machine. And anesthesia has gone beyond anesthesia machine. we're in the ICU, we're in different places in the hospital, even in the emergency, accident and emergency area. So we need to start developing safety checklists to make things easier and make it universal so that we have a guideline that everybody stick to and follow. And it also helps to enhance training. Because I remember I had an issue, I was asked to send a list to show that I have done can intubate, can oxygenate. And I realized that it's something we do every day, but we have not been able to standardize it, to put it like a protocol. So it becomes an issue. I think it's high time we start organizing things to create a system for ourselves. Because if we don't create it, nobody will create it for us.
Thank you very much, Dr. Chima. Please, I want to crave the indulgence of all participants, particularly NSA members. Check the chat. There are some information for members. I will now hand over to the president-elect. Thank you, Ma.
Thank you very much, moderator, and thank you very much, our erudite speaker. Thank you very much to every participant that was very great participation. And I have taken notes of everything that has been said. And then, like I said earlier, you will be called upon to be in some of these committees as we try to produce homegrown guidelines for our society. And I'm looking forward to all of you obliging us of your knowledge. As one of our colleagues used to say, please, using the Nigerian parlance, borrow me your brain, meaning please lend me some of your ideas. So we are going to be putting our ideas together and trying to see how we can develop some homegrown guidelines for as many of the common things we do as possible for the safety of our patients. You will see in the chat box that we are all being encouraged to pay our dues. It is important that you do so to show your commitment to the society. It's usually said that you should put your money where your mouth is. And if this society is important to you, you would like to identify with us. You don't want us going cap in hand, begging when we have you there as part of us. Please do your little bit so that you will help us to pay the bills of the society, to the World Federation of Societies of Anesthesiologists, and to keep our programs running. I want to thank everybody very sincerely. Again, to remind you that our usual time of meetings are 5 p.m. We had to move it to 3 p.m. because of our colleagues who are in Ramadan at this time. We will, by next month, be moving it back to 5 p.m. But that will be after the exams. We are going to break shortly also for the exams. Please check your WhatsApp messages as you will be getting a lot of messages from us, both on the NSA platform, and when we send to your heads of departments, they will also help us to disseminate the information in your departments. I also want you to know that the residents webinars hold on Tuesdays, every other Tuesday. This webinar holds bi-monthly. So by May ending, last Tuesday in May, expect another very interesting topic. And once again, thank you all for joining. I think that we are done for today. Thank you, President. The President had made some kind words. I'm surprised we didn't have some of our colleagues from East Africa and from South Africa. President, what happened today? You did not extend the invitation to them?
I did. They may be there. I've been checking to see whether they're there, but I did.
Please, I welcome all of you. If you were on the call and we didn't notice you, thank you very much for joining. Please keep joining and keep extending our invitation to everybody. Thank you very much. Thank you all.
I think the speaker wants to say something. The electronic hand is still up.
Oh, Dr. Shitu, please.
Maybe a final comment from
Well,
her?
thank you very much for the privilege of making this presentation. I just want to extend my gratitude to some of my colleagues, aviation medical examiners who joined in the webinar, and some pilots who work where I work. And I saw that my daughter was also on the Zoom. She is a pilot anyway, and I was quite surprised when I saw her name. I just mentioned
Wow.
it. So I
Wow.
think they also needed to kind of refresh themselves with wake-up calls regarding a checklist. And what we just presented is just like a framework which
Yeah.
you can all build. And the shell model is actually, like I said, is a functional framework where you can look at all the various aspects of your procedures and equipment and the human being in anesthesia, including the drug test. We have actually a checklist for workplace drug test in aviation, which I didn't include in the presentation. So it's a very beautiful thing that this was actually presented. And I can see one of my colleagues who was my predecessor here as the head of aeromedical standards, Dr. Haggai, is raising his hand on the platform. He is actually at Oman, but I let him know about this presentation, and I think he was able to make out time to join. So if you will crave our indulgence and just allow him make a brief comment. Thank you very much.
Yes, please. We still have a few minutes. Kindly make your comments. Thank you so much. I appreciate you very much for joining. And the young pilots, Dr. Shitu's daughter, thank you so much for supporting your mother. And thank you for being part of that noble profession. Please, I have Wilfred's iPhone. I don't know who that is. And I
That's
have
Dr.
another hand.
Haggai.
Okay, please, Dr. Haggai.
Okay, good afternoon and good evening from here. My name is Dr. Wilfred Haggai. I work for the United Nations Agency for Civil Aviation. I work in Oman, Muscat, as an expert. So I was the head of department of aeromedical for Nigeria, and Dr. Shitu succeeded me when I left that office. And when she told me about it, I said I needed to join and participate in this program. It's a very laudable program. Congratulations, Dr. Shitu, for the wonderful presentation, and I think we are happy to have you in that position. And I think this needs to be continued. For this synergy to continue, I think this discussion is to be taken to another level. We are available anytime to throw some light on some issues that may be discussed. But not to take your time, I want to appreciate this group for this beautiful meeting and this beautiful seminar. Thank you, and have a great day. Bye-bye.
Thank you very much, Dr. Haggai. That's a very kind offer you have made. So I'm going to right away include you in our committee on safety, and I hope you'll be happy to work with us. Thank you. Did I see another hand?
You're welcome.
All right, sir. Dr. Shitu, have I missed any other hand? I can't see any other hand up anymore.
I can't see any other hand. I don't think I can see
I was
any. Thank you.
one of the pilots will say
Professor
a word
Kalu.
or two.
Yes, please.
Professor Kalu, I saw Professor Tonia Onyeka. I don't know if she wanted to talk.
Okay, her hand is not up. Professor
Okay.
Onyeka. Professor Onyeka, please, do you have a few words?
Okay, yeah, thank you so much, Dr. Quinet and Professor Ogunliwaso. Thank you so much. Thank you, Dr. Shitu. This is very exciting. Unfortunately, I was in theater, so I was rushing to join because I really didn't want to miss this. I know that a lot of information has passed, and this is really. I wish we could do this again, maybe 8 months down the road, and more anesthetists will listen. This is wonderful. Thank you.
You're welcome. We will note that and see how we can make it happen. Thank you very much. So, ladies and gentlemen, beloved colleagues, we have just a minute left. And I want to thank everybody once again for making it very exciting. When you participate like this, you give us the encouragement to keep it going. Please join us again in May. Last Tuesday in May, we are also going to have another exciting speaker on another exciting topic. And please feel free to join our residents webinars every other Tuesday, where we impart knowledge on our residents who will be treating the next generation of anesthesia, those who come to us needing anesthesia services. Thank you very much. Bye, everybody.
Bye. Thank you very much,
Thank
Ma.
you.
Bye-bye.
Bye-bye, everybody.
Thank you,
Bye-bye.
Bye,
Dr. Kuku.
everybody. Thank you so much.
Thank you,
Bye.
Ma.
Thank you,
Dr.
Bye.
Professor
Kuku, thank
Boli.
you. We
Professor
appreciate
Wanso,
you.
bye-bye.
Thank you,
Thank you.
ma'am. I'm so grateful. Thank you for the honors done to us. Really
It's a
appreciate you,
privilege, my
ma'am.
dear. It's a
Thank
big
you, ma'am.
privilege. Thank you. Have a
Thank you,
nice
ma'am.
day.
Yes, you
Bye.
too. Bye.
Thank you, everybody. Professor Boli, I'll give you a private call. Thank you.
Oh, yes, Dr. Eya, thank you. Yes, I saw your chat. I'm sorry. I will respond. I know I saw it. Thank you so much. Thanks,
Okay.
everybody. It's been
Thank
a
you, ma'am.
well-attended webinar. Thank you.
Thank you, ma'am. Thank you,
Yeah,
ma'am.
NSA President. Thank you, sir.
President-elect. Yeah, thank you.
Professor
Actually, our
Dekti.
ESCO meeting is next few days. I mean, first Sunday of April. I've already noted it down. We'll bring this. We'll start discussing about this safety. And the plan is to have various, different groups to look at different aspects. We'll plan how people will now, it will be easy. We'll collect ideas and put them together and we'll circulate. And then we'll have, just like what Naji suggested, we'll take it step by step. But we'll start next month, the discussion.
Yes,
Thank
we're
you.
with you.
Thank you, President.